As a gastroenterologist, when patients come and I explain the different options, they gravitate towards the TIF procedure. Maybe they've heard about it or they've read about it, and they're coming to me saying, can I get a TIF? Or after explaining the options, they say, oh, I really want the TIF. And I say, wait a minute, we need to first do the proper evaluation with endoscopy and pH monitoring and see if you're a candidate. And if the situation arises and they have a Hill grade 3 and a 3-centimeter hernia like this case, it's a bit of a downer, both for me as a physician as well as the patient, because now all of a sudden they're getting handed off to a surgeon who's going to do something very different, and the patient's level of comfort may not necessarily be there. They've even asked me sometimes, oh, can you come into the OR also? So there's that attachment that goes away when we see the anatomy is not conducive to TIF alone. And that's why having a colleague, a surgical colleague, who also understands that GERD is truly on a spectrum and patients can be in these in-between situations. Now the option of doing a concomitant procedure, the patient feels so much better because they can still get their TIF, but we are so confident that now with a hernia repair plus TIF, we've given the patient the best possible outcome. We've worked together towards that goal, and the patient is extremely satisfied.